Hello, today I'm going to be presenting about tularemia, or rabbit fever. Tularemia is a disease caused by the bacteria Francisella tularensis, which is of the family Francisella and the only member. It has two subspecies, tularensis and holarctica. It is related to Listeria, Legionella, Brucella, Coxiella, and Rickettsia. Replication of bacteria occurs inside of a host cell. A bacteria will infect the cell and then will continue to create more bacteria within the cell until the cell eventually bursts, releasing all of that bacteria. This cycle takes about 1 hour to complete from infection to bursting, allowing for very rapid infection of a host with bacteria. It is seen exclusively in the northern hemisphere, with type A existing only in the United States and type B existing all throughout Europe. Tularensis exists primarily in animals such as rabbits, voles, mice, and hares, though subspecies Holarctica can be isolated from waterways such as rivers, streams, and ponds. Holarctica can persist in water for a very long time. Vectors include arthropods such as fleas, ticks, and mosquitoes, and small mammals that are infected. Correlation of outbreaks with rodent population has been difficult to map. Many attempts have been made to correlate the outbreaks of tularemia in a certain area to certain specific rodent populations. However, this has only had moderate success, as though there may be a strong correlation for 20 to 30 years, it eventually will shift and the correlation will no longer fit. Environmental reservoirs include, as far as can be told, only leavings from animal reservoirs such as fecal matter or carcasses of infected animals. It is incredibly infectious, requiring only 25 individual bacteria to be inhaled to be infectious to a human. It is very difficult to diagnose due to its similarity with other diseases and its comparative rarity. It can easily look much like strep, which makes it very easy to misdiagnose, causing use of ineffective antibiotics against it. All forms of tularensis will attack lymphoid tissue. Tularensis type A has a less than 2% mortality rate if treated, and its symptoms include a high fever, malaise, anorexia, and respiratory symptoms such as a productive or unproductive cough. Holarctica, or type B, has similar symptoms, however much more mild, and in contraction is more related to water, such as drinking from an infected water source. There are a number of different forms of tularemia based on how the bacteria entered the body. Ulceroglandular or glandular tularemia makes up about 95% of outbreaks that occur in Europe. This is tularemia caused by vector contact, so a mosquito or tick that has fed on an infected animal then feeds off of a human, and thus transmits the bacteria to the human. The patient will develop a palpule in the area the arthropod has infected, and this will grow into a pustule with a area of redness and swelling around it, and this will be followed by regional lymph node enlargement and a fever. The fever will be joined with unspecific symptoms such as nausea or vomiting, and delay in treatment of about 1 to 2 weeks will result in the lymph node festering, producing fluids and becoming much more dangerous. Oculoglandular tularemia occurs when the bacteria enters the body through the eye. So, for instance, when handling a dead animal which was infected and not properly washing hands and then rubbing one's eye, this will result in unilateral conjunctivitis, which is swelling of the eyelid, redness of the eye, and expulsion of fluids from the eye. A large lymph node enlargement will occur on the cheek as well. Oropharyngeal is caused by ingesting contaminated food, for instance, an undercooked animal which had been infected with the bacteria, and results in redness in mouth and lymph node enlargement in the mouth and along the neck. This makes it difficult to distinguish without more specific testing of the patient's background from ulceroglandular, because if you are bitten on the neck by an arthropod, it causes a very similar lymph node enlargement on the neck as would happen if you had oropharyngeal tularemia. Finally, there is the respiratory form, which is caused through inhalation of an infective agent. For instance, in one case in Massachusetts, 2 adolescents were mowing a lawn and mowed over a rabbit carcass which had been infected, creating an aerosol of some of the rabbit's material, which they then inhaled, infecting them with the bacteria. Type A results in a high fever, cough, chest pain, sweating, drowsiness, and weakness, and can likely result in pneumonia if not treated. And type B comparatively has a much lower chance of pneumonia development of only about 7%. It is currently considered a Category A bioterrorism agent, due to its virility and difficulty in treatment. There is a vaccine, however it is not widely used due to the rarity of the disease. The antibiotic efficacy requires timely diagnosis, which is hard given the similarity of the disease with other respiratory diseases, and the rarity of the disease makes it a much harder guess for most physicians. Its extreme virility makes it very, very abusable for bioterrorism purposes, and the widespread nature of it makes it much easier to get one's hands on than other similarly infectious agents. Thank you.